Our last guest today is Danae Blanks, a wound care nurse with Novant Health. Welcome to the show today, Danae. It's such a pleasure to have you here.
Thank you for having me.
Well, you're quite welcome. So let's talk about your role at Novant Health. Tell me what you do.
I am their certified wound ostomy nurse, and I believe I'm the only one in this county.
Wow, I didn't know that.
Yes.
That's pretty awesome. How do you get to be an ostomy or
It's called a wound ostomy nurse.
Okay, well, what is your background in your education, and how do you become one of those?
Well, first off, you have to have a bachelor's.
Sure.
And I do have a bachelor's, and then I also have a bachelor's with journalism and marketing. And later in life, I decided to be a nurse. And I went on and got my nursing degree. And then from there, after working on the floor, you had to have at least 2 years experience. And after working on the floor, I got approached if I would be interested, because I did the wound care at another facility, if I would be interested in going to school. And I ended up going to Emory Medical University, the School of Nursing, and got all my certifications. But then you have to test nationally in each area for either wounds, ostomy, or continence, and I am just wounds and ostomies. So you test every 5 years to keep your credentialing so that you can practice as a wound ostomy nurse.
Well, that's interesting. I wasn't aware of all that. Today we specifically wanted to talk a little bit about the wound care services offered by Novant Health. Now, I know that you said you split your time, half your time with Novant Health at the hospital, and then with Oceanside Family Medicine and Convenient Care in Shallotte.
Correct.
So tell us about the types of services that you offer in the hospital, say.
In the hospital, I work very closely with all of the physicians, more so with the surgeons and the orthopedic side, and I'm with the hospitalist, and I work with anything from I go into surgery often and help with severe dressings, or if someone is going to end up with an ostomy bag, I'll go in and work with their anatomy to figure out what will fit them the best. If I'm not in the surgery part of it, then I'm on the floor and I'm working with anything from vascular issues, ulcerations to the legs, to decubitus, to someone having a traumatic injury. And I work with that person and their lifestyle to figure out what I can do to help their tissue grow back. And as far as with the ostomy side of it, if they end up with an ostomy bag, I begin the education usually before the surgery, and then I work with them for a very prolonged time after to help them learn to manage their change in lifestyle.
So when you're performing your duties at the hospital, those are primarily patients who are there for overnight stays, correct?
Yes.
But then when you see patients at Oceanside Family Medicine and Convenient Care in Shallotte, what kind of services would you offer there?
I offer the same, because what usually ends up happening, even though you're discharged, because length of stay is very short. Once you're done at the hospital, you need follow-up care. And I work with the home health agencies a lot of times, and then I work with the physicians, and the physicians will send the patients to me. And I will continue to work with them to get that wound to heal wherever it may be. And it's not just about the wound. I work with them on their diet to help them get the right nutrition to help it heal, and so forth.
So primarily then you're following up on the patients who have been discharged from the hospital.
Often I am.
And then I assume that anytime a tissue breaks down and they're just a patient there at Oceanside Family Medicine, you would probably follow up with them.
But in order for them to see me, they do get referred to me through a physician, and we work through it that way.
Can physicians other than Novant Health Medical Group physicians refer to you?
Absolutely. I'm getting them from down in North and South Myrtle Beach. I'm getting them from the other side of Wilmington already. Ash, Whiteville. I'm getting them from everywhere. So as long as they usually call in, find out what they need to do, the process in order to get the referral through the system, and we go from there. And then I call the patient and set everything up.
And so you would see that patient then in Shallotte, is that correct?
Correct. Outpatients, 100% Shallotte.
Well, do patients call you directly sometimes for
Often.
appointments? How does that work?
My name's out in the community.
They just hear about
They
you?
hear
and
about
they
me and they say so-and-so from church or however, and they'll call me directly, and what I end up doing then is directing them how to get in touch with their physician to get the referral through. And usually I know that physician as well. I will place a call and say, I had a concern from one of your patients. Would you like me to see them? And I haven't had anyone say no yet.
So you get referrals from primary care and from surgeons' offices and just
Everywhere.
everywhere.
I get them a lot from literally from everywhere.
Wow.
Plastics. I get a lot of plastics.
It
too.
sounds like there is a huge need for your type of service.
There is. I usually am back to back. I average probably anywhere from 10 to 15 patients hands-on a day,
Wow.
5 days a week.
Well, I'm so glad you were here today because it sounds like it's something that we really need to talk about out there in the community so
do.
that folks know where these services are available. So how might we reach you? How might they reach you to schedule?
I think the simplest way would be just to call one of my main office numbers, and do you want me to, I can state it. It's 910-721-2018. Just call it, leave me a message, and I'll get back in touch with you at the quickest I can.
And we can run that on the bottom of
would
the
be great.
screen too. That way folks will know. Well, thank you so much for being on the show today. It's a very interesting topic that I know absolutely nothing about. So
I enjoy what I do.
it was great to have you here, and I hope you'll come back and tell us how it's going.
Absolutely.
Great.
Thank you for having me.
You're welcome.